When using piezo as opposed to magnetostrictive, it's important to remember the movement of the tip is lineal. It's a side-to-side, back and forth motion. Therefore, you use only the sides of the tip as if you were using a hand scaler. Using small, fine movements of 1 to 2 millimeters and scaling with the tip is the most effective method. Remembering to angulate and turn around the corners as you would a hand instrument. Never use the back portion or the front portion, as this will hammer against the tooth and cause sensitivity to the patient. It's important to control your tips regularly for wear. With hand scalers, it's quite easy. We check to see if it's dull, we sharpen it. If you no longer can sharpen it, you throw it away and you get a new instrument. With ultrasonic tips, it's a little more difficult. Therefore, there is a chart created exactly for this purpose. Place your tip on the paper and measure it according to the line and the deviations here. If you're missing more than 2 millimeters, then your tip is no longer effective. You will need more power, therefore creating more heat and possible damage to the tooth if the tip is shorter than this. If you're missing more than 2 millimeters, it's important to throw away your tip and buy a new one. When using piezo, the pen grasp is the most effective. Placing your instrument between your index and your thumb helps create little rotations for adaptation of the tip. Using your ring finger as your fulcrum point and fulcruming very close to where you're working. Remember, we're using lateral movements, so you want to insert the tip using 1 to 2 millimeter movements and slowly rotating as you go around the tooth. This will help you stay on the lateral sides of the instrument. Therefore, this will allow you to adapt the tip properly to the surface you're working on, therefore creating a very gentle treatment for your patient.